Okay, Doc, this next question, you can clearly see it involves pharmacology. Like I always tell you, let's read the last two lines. It's very important. And if you're not using this technique, please start doing it immediately. It allows you to save time. Also, make sure you know what they want from you, from us. So, the physician prescribes a drug that blocks peptide transfer by binding to the 50S ribosomal subunit. Which of the following drugs was most likely prescribed? Okay, so if you do know the mnemonic buy at 30, sell at 50, you can clearly stop right here and go below. Buy at A is aminoglycosides, T is tetracycline, sell, CCEL is clindamycin, chlorphenicol, erythromycin, and also linezolid. So those four drugs would be the 50Sers. At the same time now, you can go top to bottom and eliminate, but I will go to the top and read the whole scenario just to make sure, and then from there continue and knocking out the answer choices. So a 51-year-old man with alcohol use disorder comes to the doctor, fever, and productive cough. Okay, x-ray of the chest, right lower lobe consolidation, and diagnosis is aspiration pneumo. So we're kind of lucky because they gave us a diagnosis. So points of entry, you have the MOA of the drug, and then you go to the top. If for some reason it's not clicking, you can look and the scenario is presented to you that the person has aspiration pneumo. Right away, you have to start thinking a few things, right? Aspiration pneumo, foul smell, foul sputum, alcohol use, any kind of a condition that affects the swallowing. They love to present something like that on the exam. So now you say, okay, we use a mnemonic, buy at 30, sell at 50. If you have the first aid, please open it up. It's right there in front of you. And by doing that, we start knocking out answer choices. We're like, okay, so tetracycline, doxycycline, that's a 30S subunit. That's not this one. We knocked it out. Metro, that's a whole different MOA. Knocked that out. Levofloxacin, fluoroquinolone, this is not the MOA for that drug. Knock that out. Now, clindamycin, well, yeah, that's part of the CCEL mnemonic. We can leave that in. Azithromycin, well, we have erythromycin, azithromycin, clarithromycin. These are macrolides, and that fits under the mnemonic CCEL. So buy at 30, sell at 50. So we'll leave this one in. We have piperacillin with tazobactam. We take that bad boy out because it doesn't fit this MOA. And ceftriaxone is a cephalosporin. So that's out too. So now you say, well, what do? Do we call AMBOSS because we think they made a mistake? Can't be two of the same answers. Can't have two answers. Well, yes and no. Please don't call AMBOSS because they didn't make a mistake. These two do fit the criteria of the MOAs are the same. They block the peptide transfer by binding to the 50S subunit. Here's the problem, or here's the issue. It could be a problem if you don't know the content. It's aspiration pneumo. We need to know that it's an anaerobic organism, not aerobic. Anaerobic organism. So clearly only one of these drugs are prescribed for anaerobic infections, and the other one is prescribed for community-acquired pneumo. And this is where you can use mnemonics up to a point, and it's very valuable, like the ones that we have in first aid, because they help you remember the information and recall a lot faster, like we just did right now. We saw the 50S, we thought cell, CCEL, automatically you knocked out most of the answer choices except two. Now we need to know that aspiration pneumo, clearly because it's alcohol use disorder, fever, productive cough, x-ray, consolidation, right lower lobe, classic textbook presentation of aspiration pneumo. They might never tell you aspiration pneumo, but they present to you like the foul smelling of the sputum versus the x-ray consolidation versus alcohol use or something dealing with swallowing, dysmotility, something, myasthenia gravis, ALS, something dealing with issues like that. They will give you in the scenario, Parkinson's, something like that. But we're down to two drugs. And this is where you need to know some information. So clindamycin will be the answer. Clinda is prescribed for treatment of aspiration pneumo. And azithromycin, we mentioned before, are macrolides. So azithro, clarithro, and erythromycin, these three are treatments for community-acquired pneumo, not for anaerobic organisms. And a little trick that helped me remember is when I see macrolides, M-A, so you have A-C-E. Azithro, clarithrol, erythro, macrolides. So this is what I want to show you is as you watch more of these videos, more of me navigating you through different scenarios and all different topics and systems, I want to show you ways that you don't have to memorize. You need to leverage yourself on exam day. There's so much information you have to know. It's not easy. You can't memorize everything. It's impossible. I'm telling you it's impossible. But what you can do is learn as much as possible, understand certain concepts and different pathways and whatnot. Memorize what you can if you need to memorize. But something like this, you see ACE, azithromycin, clarithromycin, erythromycin, ACE, macrolides, part of the CEL mnemonic, which blocks the peptide 50S ribosomal subunit. So doing it this way will definitely help you practice. I know it's not easy, but you'll realize different questions have different ways to approach them. Some questions are easier than others, but we do our very best to provide you all the exposure to the most common, if not high-yield scenarios, that either way you'll be experienced with the information that will help you on exam day. So to summarize, 2 points of entry. The MOA is here. The presentation is here above. You need to know the mnemonic or just know which drugs have certain MOAs. I love using mnemonics. We narrowed it down to 2. From the 2, we needed to know that this one is not used for aerobic. It's used for anaerobic organisms versus azithromycin is community-acquired pneumonia. So I hope that helped. Keep practicing these skills each and every day with more and more questions, and you'll start seeing more of an improvement.